Hello, everybody. I'm Dr. Salvador Medina. We are here in our office in Aroah Center in Tijuana. I wanted to talk about an interesting topic, which is post-bariatric surgery. A big part of my practice are these patients. Post-bariatric surgery means that a patient that has gone through a bariatric procedure. This entails that there was a certain degree of overweight. Then they do the bariatric procedure and they lose a lot of weight. This has a very important impact on your body. Sometimes patients that go through a bariatric surgery don't really know what's going to happen afterwards. They don't really expect these type of changes. What happens is that the skin loses its capacity of retraction. So we end up, after losing a lot of weight, we end up with a lot of loose and extra skin in basically all our body. Breasts, abdomen, the back, the butt area, the thighs, the arms, the face. Now, there's some patients that don't have a bariatric surgery. So that's why I prefer to use the term massive weight loss procedures. It can be through a bariatric surgery or just a change in your lifestyle, exercising, and a healthy diet. Patients that go through this weight loss process suddenly see that there are very important and dramatic changes in your body. They come to a point where they realize that all these changes, it's difficult to live and have a healthy lifestyle with all these important changes. Many patients that have lost a lot of weight come to us because they want to address all these issues. What we do is patients that have an interest or a desire of having a better contour in their body, we ask them if they contact us, and from there we start a process where we analyze all your medical records, see what type of procedures you had, how much your weight was before you lost all this weight. If you have any other diseases, it's important to know if you had or still have diabetes, high blood pressures, if you had any other surgeries, if you had any other complications during surgery. So we have to analyze all your background and then decide if what is the best treatment of the areas that you want to change. There are different techniques. It's a very vast area where we have different techniques to address different areas. In these patients, it's important to know that there are many areas in the body that we can treat. It is impossible to treat all the areas in your whole body in one procedure. So we need to stage these procedures. That is very important. There are some patients that they think that we can address all the body in one procedure, and that's not possible. We always have to think about your safety in surgery. So we need to stage these procedures. I would let you know which procedures we can combine and which we can't combine. There are some standards that I like to meet that are safety standards. So once we decide what is the best way to address your areas of concern, what you need to know is that we will help you and go through all the process for your procedure. We always help you with transportations. We ask our patients to fly into San Diego's airport, which is pretty near from here. It take 30 minutes or so from the San Diego airport to our office going into Tijuana. It's a short drive. We will arrange that transportation for you. You will come here to our office. We will do blood work, consultations. We always do a consultation with a cardiologist before your surgery to see that everything's okay, that there is no issues that would alert us and maybe prevent or contraindicate a procedure. For us, it's very important that you have to go into surgery in the best conditions possible. We will help you with all this process. We will help you with transportation to the hospital. We do it since they're pretty big surgeries. We address large areas. We take a lot of hours in the OR. We do these procedures in a hospital setting. This hospital is probably one of the biggest hospitals in the city. So we have everything we need for you to be safe and for a good recovery. We help you with the post-op care. Here at Aroah Center, we have a lot of things that will help you with your recovery. We can do a post-operative massage, lymphatic drainage, post-op visits. We also have many other things that we can offer you and you and your companions here at our clinic. There are many things that we can always give you all this information that can have to do with your recovery, skincare routine, skin treatment. There are a lot of things that will help you have a better post-op recovery. In patients that have lost a lot of weight, it entails a large series of procedures that we do very often in our practice. So I would let you know what is the best treatment for you, and we can offer here in Aroa Centers the best recovery for the best result that we can get. So if you have any questions, let me know, and we can always answer anything that you want to know. Thank you.